incontinence, or the involuntary loss of urine, is a common condition affecting as many as 25 to 75% of women, depending on age. My name is Lisa Pear, and I have been a women's health nurse practitioner since 1992. I have worked over 20 years in gynecology with an emphasis in urogynecology. Urinary incontinence may present as urge urinary incontinence, stress urinary incontinence, mixed urinary incontinence, or overactive bladder, and have been estimated to have an annual direct cost of $19.5 billion for incontinence care. Urge urinary incontinence is the involuntary loss of urine associated with urgency. Overactive bladder is characterized as urinary urgency, frequency, and nocturia, with or without urge incontinence in the absence of pathology. In the United States, it's estimated that as many as 36.4% of the population experience urge urinary incontinence. Stress urinary incontinence is defined as involuntary loss of urine on effort or physical exertion, such as athletic activities or sneezing and coughing. Approximately 37.5% of women ages 30 to 50 years describe stress urinary incontinence during primary care visits with a healthcare provider. Unfortunately, many women do not report their urinary incontinence symptoms to their healthcare provider unless asked. That is why screening patients for urinary incontinence is an important first step. The Women's Preventive Services Initiative recommends screening adult women of all ages annually for urinary incontinence, and, if present, assessing the effect incontinence has on their quality of life. When urinary incontinence is identified, asking questions to differentiate the type and determine the severity of distress caused by incontinence is critical to direct the evaluation and management plan. It is important to identify the onset, character, degree of bother to the individual, and treatment preference. The physical examination should include a focused genital urinary system physical examination and in-office assessment test. When history, physical exam, and in-office assessment tests indicate urinary incontinence, imaging studies and urodynamic testing are not indicated for individuals who desire conservative treatment. The nurse practitioner in a primary care practice can initiate conservative therapy that includes counseling on lifestyle modifications to reduce risk factors, behavioral training to extend voiding intervals, expand bladder capacity, and decrease incontinence episodes, instruction on pelvic floor exercises, incontinence pessaries, and pharmacologic treatment. First-line treatment recommendations for all types of urinary incontinence include lifestyle modification and behavioral training. The use of medication is dependent on the cause of the urinary incontinence and may or may not be appropriate. Individuals in whom a diagnosis of urinary incontinence is unclear or who have complex presentations such as associated pain, abnormal results in-office testing, significant pelvic organ prolapse, or complicated health or pelvic surgery histories should be referred to a urogynecology practice. Nurse practitioners in primary care settings can screen, evaluate, initiate, and monitor conservative management for urinary incontinence based on patient preference. Optimizing continence through conservative management can improve the quality of life for women and decrease the cost for individuals and the healthcare system. In the June issue of our Women's Healthcare, a clinical journal for nurse practitioners, we provide a CE article on the evaluation and conservative management of urinary incontinence in women. The National Association of Nurse Practitioners in Women's Health is also partnering with Patient-Centered Outcomes Research Institute to make available the most up-to-date, evidence-based information for both patients and healthcare providers about treatment for urinary incontinence. Our common goal is to promote shared decision-making regarding available options. So, as we see patients for their primary care visits, let's consider incorporating that important first step, screening for urinary incontinence symptoms. We may improve their quality of life.